in dog terms, they say weight measurement. Compare the dog's current weight to breed standards or prior healthy weights. Breed standards. Let's talk about that. If you have a small, petite dog, the dog should weigh less than if you have a large dog, for instance, right? Same with humans. Like, it's very interesting how much weight somebody can carry around the taller they get. And they think, oh, I'm big boned, I'm tall, I'm big. But I can't tell you how many patients I had who were, really tall dudes and were sitting in extreme metabolic compromise because they did carry the weight well. When they're tall, especially kind of a tall, lanky build, they can hide their fat, if you will. And then we have to look at Asian populations and Eastern Indian populations. Those folks at smaller adipose excess will be more prone to type 2 diabetes and metabolic dysfunction, meaning they have less leeway. They have less leeway of the ability, like Caucasians can pack on more fat and be at lower risk potentially. This is case by case, but I'm talking generalities, than their Asian counterparts, because that's just how it is. More risk there. And different groups of people will have higher risk. So we have to be very careful in making blanket statements about parameters around metabolic health when people really should be going and having their doctor assess them. That's what the guide's for, the Assess Your Metabolic Health Guide. It'll give you exactly what you should talk to your doctor about. Very simple. These are lab tests your doctor will do anytime you go in for a physical exam anyway, so you might have them laying around your house. All right, so assessing risk for future diabetes in a dog. Risk factors identified. Obesity is the strongest modifiable risk factor for diabetes in dogs. Let me repeat that. Obesity is the strongest modifiable risk factor for diabetes in dogs. Age, middle age to older dogs are more at risk for type 2 diabetes. Another factor that they consider for risk is intact male dogs are at lower risk than spayed females. Why is that? Intact male dogs have their testosterone, and spayed females are essentially in menopause. Concurrent conditions. Chronic pancreatitis increases diabetes risk. How do you get chronic pancreatitis? That's fatty pancreas. So dogs get fatty pancreas, humans get fatty pancreas. We also get fatty liver. Those increase the risk for diabetes. Chronic steroid use, obviously for allergies or inflammation. So some humans that I've had in my clinic had gotten tons of cortisone injections, and that put them at higher risk for Cushing's disease and then onward into diabetes. So the diagnostic tools and tests would be blood glucose testing, urinalysis, insulin testing, a lot of the same tests we're going to run on humans. And then preventative measures. This is for obesity and type 2 diabetes risk in a dog. Dietary management. Feed a balanced, well-portioned diet designed for weight management or diabetes prevention. High protein, low carbohydrate diets can improve insulin sensitivity. Regular exercise, daily activity supports healthy weight and glucose metabolism. And then monitoring and maintenance, regular weigh-ins and, body composition testing, and then early intervention if weight gain or blood sugar irregularities occur. So that is the information that we need to know about dogs. And I think how it can translate into humans is very similar. Can you palpate your ribs, or do you really have to push in to find them? What is your waist circumference like? Do you have a waist? And do you have a pendulous belly that is interrupting your tuck, if you will? Those are all factors to consider. And obviously, check with your doctor, talk to your health professional. This is not for diagnostic, prevention, treatment, none of that, cure, none of it. I'm just trying to educate you because I think about this a lot with dogs, and I'm always trying to keep my dogs on the leaner side so that they don't run into any downstream issues like joint issues, pancreatitis issues, all different kinds of issues that could be thwarted if I kept them at a very healthy weight and physically fit. Same goes for humans.